This is the Neuro Way to Practice podcast with Dr. Ted Arkfeld. In each episode, he shines the spotlight on patients who have achieved amazing results the Neuro Way. Now, here's your host, Dr. Ted Arkfeld.
Neuro Way to Practice podcast. And tonight, we're going to answer the question, why does ARP therapy achieve superior clinical results than, say, traditional chiropractic alone, low-tech rehab alone, and more importantly, traditional physical therapy alone? As always, we have Jake Cozens with ARPneuro with us tonight. Jake, how you doing, buddy?
Pretty good. How you doing, sir? It's good to see you again.
Hey, you were at this past weekend. You were at the winter meetings for Major League Baseball. Tell us about that. Tell us how it went and what kind of experience it was. It sounded fun.
Yeah, it was. We were at PBATS, if anybody's familiar with that. It's essentially just like you said, it's Major League Baseball. All the athletic trainers were there from every team in the MLB, and we were able to pitch to all of them. It was sort of like speed dating. So you have about 7 minutes. You're sort of on stage, and you have a team of maybe 4, 5, or 6 that are sitting there and they're listening. And you have 7 minutes on, 7 minutes off, and it just cycles through all day. And we had great results. It was very exciting. I went in there not knowing what to think, and we left very excited with a lot of new faces and a lot of new interests. So
this isn't something you just sign up for or pay a fee and you get to go to, correct?
That's correct. We were actually we didn't apply. We were invited. And that's kind of how that started. And now that we're sort of, in the loop, looks like we'll be there next year as well, hopefully.
So what was your 7-minute, elevator pitch? What did you tell the athletic trainers in Major League Baseball about ARPneuro?
Yeah. So I'll shorten it down, ironically, in this particular case, but we went through several slides, and the major premise behind it was how quickly we get results, and how we can use your craft, whether you're an athletic trainer, a chiropractor, a physical therapist, in using this technology with your craft, and how it can essentially cut the recovery time in half. And we shared several results with the MLB and other professional athletes that we've used over the years on how they essentially got on the field faster, got on the ice or the court, whatever the case was, much faster than they would have if they weren't using our technology. Again, the biggest thing is how is this like a TENS unit? Is it a TENS unit? And that was probably the biggest question of those who didn't know it. But, we leaned immediately on the neurological aspect of it, as opposed to what a TENS unit does just physiologically from an alternating current.
So what were some of the other vendors? Was there anybody else like ARPneuro there? Was there laser companies there?
Mm-hmm.
What were some of the people around you?
There were a few. So Shockwave was next to us, and we get compared to Shockwave a lot, but it's the technology is completely different. The way it's administered is completely different. So I don't even know if I would consider them, one of our competitors. We talked to them. We were very nice to them, and vice versa. They were nice to us. We did have a few others. Mark Pro was one of them. We get compared to Mark Pro a lot. How is this like Mark Pro, especially with our PRS? But again, I don't look at Mark Pro as being a competitor just because the technology is astronomically different. Mark Pro is great for blood flow, muscle recovery, things of that nature, but it's getting to more of a superficial level as opposed to a cellular level, like on our PRS or the RX. So it's like apples to oranges, but Mark Pro was actually there, and again, very nice to him. And we had a good response from them as well.
So did the athletic trainers seem to gravitate more towards the PRS or the RX unit?
It was interesting. They really loved the PRS. They loved the way it was built. It was hardy. Those are words directly pulled from one of the athletic trainers. He liked how hardy it looked, where you can literally, they know these guys are going to kick it around, and They're traveling with it, they're throwing it in their duffel bags. And so it looked like it could take a beating. And of
Okay.
course it can, and it's super durable. So not that they're not, I mean, there's a lot of teams that do have our RX, so they know somewhat where the technology is, but the PRS was definitely the star of the show.
So does the Dodgers, do they have the PRS right now?
They do. They have multiple PRSs, as well as one or two RXs, I believe.
So do they use that like after a pitcher gets done with their appearance? Because I thought I heard at one point that instead of the pitcher, traditionally they would come into the dugout and head right away and get ice placed on their shoulder or arm. Are they replacing that application with a PRS session?
Nope. Now originally, I think they were. They do have a different athletic trainer than there was there that originally brought our technology in. So I don't know if it completely replaces the old school method of ice and using ice afterwards, but it was their premise in the beginning. The last time we were there, I haven't been there for about 4 years, but at the time it was all about blood flow. They did not believe in the ice. They were well into the science and the newer studies that came out where it's talking about blood flow. So I hope they continue to embrace that, because when we left it, that's where they stood.
Okay. Was there any teams that were interested in the physical performance or the physical training aspect of it, where not the recovery, so to speak, from an injury, but actually from, hey, let's build some muscle, let's for strength and conditioning? Anybody interested in that aspect of it or comments about it?
Yeah, that's a great question, because there was interest in the performance side, and on top of that, I had a younger athletic trainer actually bring up, some of the athletes he works with that in the recent, they all like to kind of feel their motion, whether it's feel their swing, feel their pitch. And he was very excited with it to just neurologically connect with these athletes. So whether they're injured or not, I mean, they're perfectly healthy. His idea was taking this and actually placing on certain muscles where they can go through that motion and just feel those muscles activating. So it was an interesting way to look at it, because we do that with a treatment side where we're going through a slower movement and it's firing up the muscles. But he's looking at it on more of a performance side, which I thought was interesting.
Okay, so for anybody that hasn't, and I can't imagine why you haven't, but if you have not seen an earlier Neuro Way to Practice podcast, we've gone over this. But Jake, you do it so eloquently. Will you please discuss the scanning process and what we're looking for in the scan process, and the the whole reason,
Sure.
for scanning with an RX unit?
Yeah, and that's the original way to go through the treatments. And I'm glad you brought it up, because there's this myth that recently we've abandoned the search, and we haven't abandoned it. I think we've placed it in a different position, probably a position that it belongs. But the scan has the ability to essentially find muscles that aren't activating properly, whether they're dormant or whether the timing is off. And the interesting thing about it is, your brain contracts muscles between 2 and 20 times per second, depending on, what part of the body you're looking at. And so at rest, your body is not going to necessarily know if a muscle isn't firing properly. However, our RX contracts muscles at 500 times per second. So if there's a muscle that's not healthy, that's going to be shocking to it. No pun intended. But it's going to go over all these other healthy muscles, and it's just going to feel that traditional pins and needles feeling that you would in a traditional treatment. What happens is when it goes over an area that just isn't able to absorb force, it lights up a lot differently. While there's pins and needles, it almost feels like it's a poking or jabbing. And in many cases, the athlete or the patient does not want that pad in that area, because it's an indication of a muscle not able to absorb force. We essentially wouldn't know that at 2 or 20 times per second, but when you blast it at 500 times per second, suddenly it starts to rattle things that normally wouldn't respond. And then we take that as an indication of a hot spot. And we anchor the pads there, and then we run through a treatment based on those pads that we never would have perhaps guessed otherwise.
Okay, so now let's go with the treatment from a neurological standpoint. What's the purpose of the pad? So we found the hot spots, you got the pad placement, and you're going to take a patient through a movement that has been difficult or painful for them. What is happening between the pads and that is making this therapy so successful?
Yeah, perfect question. And this response is even better at the higher speeds. For instance, like the 500 contractions per second. Just for those of you who aren't aware, you can actually drop the contractions down to 40 per second. But in this particular case, where the pads are placed, and a lot of times they're not very close. Usually they're spread out. And let's just say that the issue was something to do with the shoulder, and hot spots were infraspinatus and maybe like medial bicep or biceps tendon. And what tends to happen is as you're turning up that output power, you're going through a movement, like you said, Dr. Arkfeld, that the patient just struggles with. That's where they feel the most of the pain, or the range of motion isn't there. And it's not just the pads themselves or those particular areas that are actually firing up. It is actually going through, the black is literally going towards the red and searching for that pad. In that process, it's waking up muscles in between that search where it's looking for that pad. And at the same result, your brain is also neurologically connecting to that. So if there was, in fact, a muscle that was dormant or not timing or not firing on time, this is an indicator that will fire up, and your brain will start to neurologically connect with that muscle again. Kind of like when you're tapping a muscle, during a workout to kind of, remind your muscle to put that mind to muscle sort of focus. This is essentially the same thing, except you using direct current to do it.
So to delve a little bit deeper into the neurology of it, and Jake and I have had numerous conversations about this. So it'll be 4 years ago in February that I brought ARPneuro on, and when I met Jake for the first time. And so they were talking about this neurological aspect in between the pads. And I just kept asking, well, what's happening? I mean, the question I asked was, how's it getting up to the brain? Now, I'm not going to bore you with the various spinal tracts and how it makes its way up there. But where it does get to is that we have a map in our brain called the somatosensory cortex. It's like a little map of a man with with our toes and low back and everything like that. Those represent areas, and so one of the reasons that I know that this is far superior than anything, and why I think we get the results that we do, is because those body parts, like after surgery, those body parts have not been moving. They have not been engaging. We are a body of receptors, and the ARP therapy is specifically going into the muscle spindles and the alpha gamma loop, right, Jake?
Correct. That's correct. Yep.
And then that fires on up to the brain. So that's why the signals are making it up. Now, I was recently, this last weekend, I was at over in Chicago getting more training at Dr. Sam's office, and Dr. Sam Battaglia, and I thought I knew what I was doing with art therapy, and this was just mind blowing what he did. I learned so much over there. I take the blame because I wanted to go over really about 3 years ago, and I've just kept putting it off. And then his schedule didn't mesh with mine, and you know how that goes. We all get busy, blah blah blah.
Sure.
So I finally made it over. I spent just a morning with him, and he is the master. I mean, I saw how he scanned. I saw how he has patients go through different movements, the repetitions. I mean, for the most part, he stays with the protocol, but and this is what the biggest knock I have on PT right now is that they are very protocol driven. They are based their financial reimbursement like anybody that is submitting to insurance, chiropractors included, if you're doing therapeutic exercises or what we call physical medicine and rehab codes, they're time-based codes, and they're based on 15-minute increments. So for one unit, you need to have a patient do something for at least 15 minutes, and that you get paid, anywhere from $29 to $30 for that unit, depending on the insurance company, depending on the area of the country you're in. So it's very typical. It's a norm because it's just been established there, and that's just the way it is. That you put a patient on a stationary bike to warm them up for 15 minutes. Okay. And then you move them into maybe some stretches, maybe some stem, and then maybe some, you could be there for an hour and a half. It's not, it's not nearly as efficient as an ARPneuro provider, because we bring them in, and Dr. Battaglia was so wonderful at this. He brings them in, he gets them hooked up with the pads right away, and he gets them going. Now, he may just get them going with the stimulation based on his scan, but then he will maybe warm them up a little bit with a little intensity, but then he gets them going with their exercises. That could be shoulder flexions, it could be lateral raises, it could be anything that's going on. Squats. One of the things that I saw him do was Bulgarian squats for one of the patients. Yeah. He had little Bosu pods, and that he had him doing balance while doing things. By the way, our first round of Bosu pods came in today.
Nice.
I mean, we're super fired up about that.
You'll love them. Yeah.
So what he is able to achieve in 20 minutes of time, I would say would take at least 3 hour and a half sessions, even that, for a PT.
Yeah.
And you get more work done in a shorter period of time. You're focusing on the problem area, the cause of the problem, because, right, Jake, that's where the scan
100%
find the cause.
Yep.
How many times did somebody at an office, or even when you were in Dr. Battaglia's office, they come in with, let's say, a shoulder problem or an elbow problem, yet when you found the hot spots, they weren't anywhere near the shoulder or the elbow, right?
That's often the case when you scan. It's very surprising, and sometimes you try to guess, but in these days, I guess you can get a little bit better at it. But some of it still surprises me of like what those breakdown points are.
I don't know of any diagnostic procedure you can run that can replace the scan to find out where the breakdown is, where those muscles aren't absorbing the force. The protocol used to be that you would scan for the first 4 visits, and like Jake said, patients don't like that. This is not a pleasant stimulation because that muscle can't absorb it, and so we stopped doing 4 visits. We started doing that actually before you guys even recommended that.
Yeah.
And we do it as part of our initial evaluation. We do that first of all because if we go through our range of motion, our muscle testing, and we will see a gross muscle that is weak. That can give us like the general anatomical area, and then we fine tune it, and it's like finding the needle in the haystack when you go in for the scan, isn't it?
100%. Yeah.
Hey, by the way, were you able to meet the folks from Kinetisense down at the baseball meetings?
I walked around. I believe I saw their table, but I did not see them.
Okay.
So yeah, I never got to say hello.
All right. So Kinetisense, everybody, Kinetisense is our movement software we have. We basically have a movement laboratory in our office where it's computerized, and we can do range of motion movements, we can do squat, we can do postural assessment. I mean, the things that this thing does, it gives us the baseline information so we see where the abnormal movement pattern is. And then from there, we can really focus in on the musculature. So like if you come into our practice, we are going to have you, before we see you, we're going to send to you, it's through a company called ChiroUp, and it's going to be the history. So you're going to have everything about what's going on with you, the chief complaint, the past medical history, social, everything. And that's going to come to us. And that way I don't have to take 15, 20, 30 minutes taking down the history and typing it in front of you. It's there. We review it, and then we get right into the exam, because that's really why you're there. It's to find out what's the cause of your pain, the anatomical source of the pain. So we will do we'll start off with, we have what we call a brain tap neural check, where we're going to check the autonomic nervous system, see how stressed you are. Then we go into kinetosense, our movement, and then we'll do JTEC muscle testing. And it's all computerized. It gets us to numbers, and then we come in with the scan. So it's so fun as a practitioner to get all this information. And we sometimes try to go, oh, well, we think that the scan's going to produce the hot spots here or there. We are always pleasantly surprised, because it is many times not where we think the hot spots are going to be. You cannot palpate a hot spot. You cannot take, and I've tried, believe me, I've tried all the things. I've taken a hypervolt massage gun and run it at high vibration speeds over to see, and it's just not the same. The only way that you can truly find the hot spot is with the scan.
Yep.
And that was reinforced with the visit to Dr. Battaglia, because I was asking him, patients had they had an elbow issue, and he had a pad there, and then he had a pad back on their scapula. And I go, where came from the scan? He goes, that's what my scan, you don't go against the scan, trust the scan. And then, so then I watched him do the rehab and the exercises and everything. It was a wonderful experience. But you don't need, and I have preached this for so many years with chiropractors, I wanted them to get into rehab. And one of the things that I always hear is, well, you got to have a large room. You got to have a room with all this expensive equipment. And you don't,
Not
do you,
at all.
Jake?
And I mean, you're referring to Dr. Battaglia. His rooms are, average size. They're not huge, and he pulls it off.
Mhm.
He does a great job with that.
Yeah, his rooms are bigger than mine, and you don't need. Many times PT has an open bay. You come in, there's all this equipment and everything in there, and it looks impressive. But I'm going to say it, and I just don't care, because this is what I firmly believe. I've been in practice for 35 years, and without ARPneuro, I wouldn't make this statement. First of all, without ARP therapy, I would not be treating post-surgical cases, knees, shoulder, and we're doing it. And by the way, we are getting superior results. One thing that I really liked about what Dr. Battaglia was doing, and that we do too, every day is a new day for the patient. We are not protocol focused. If they come in, we may be upping the intensity. It may be a recovery day because they are sore. They're still going to get ARP therapy, but we're just not going to take them as hard as we did the day before.
Right.
To me, that's called patient-centered care. And I think that's another reason why we get the outcomes that we do. I'm sure that you've seen this at other ARPneuro clinics as well, right? They just don't get bent on the protocol. It's about the person.
That's very true. And one of the things I often say to a lot of the doctors is, the protocols are great. They're a guide, and learn them, get really good at them, get comfortable with them. And then don't be afraid to go beyond the protocol, because that's how new, better things have been developed over the course of the years with this technology. So I'm always a big proponent of trying new things and kind of going outside and not sticking to the particular protocol, just as a cookie cut type treatment. I don't think it works its best that way.
I was talking to our movement specialist in the office today, Livy Jeffers. By the way, big news, if any of you know Livy, over the weekend, she was in Chicago too, and she got engaged. Wow. So congratulations to her and Liam. They're engaged, and it was a total surprise to her. And so happy for those guys. I've known them since they were in high school, and just wonderful people. But I was telling Libby that we can't, we got to go by the patient, and she has an exercise science background, was going through some personal training certifications and stuff. And I said, I hired you so that you can become a mad scientist with this therapy. Take your personal training background, the different movements, the different exercises, and she's a big
Nice.
CrossFitter. And so I said, take that and let's bring it into the clinic, modify it somewhat for our patients, but you can get as creative as you want to. Jake, you've been to my practice. You've seen me take Bosu ball. I took the big Bosu ball because I didn't know they had the little
Yeah,
pods.
those are
Thanks to
nice.
Dr.
Yeah, you
Gagnon.
learned that in Chicago with him. That's the first time I saw
I
that.
did. And but we use a thing called motion guidance. Motion guidance is a flag system. It has like these patterns on a flag. You can put them on the wall. You can put them on the floor, and it's a laser light, and they have straps, and it's a way to get visual cues so the patient just doesn't get bored looking straight ahead doing squats, but they can get visual cues to see how well and how smooth they're going. We do that. The one thing that's really cool about that is that the straps actually anchor the pads, the ARP pads on
Nice.
as well. So we do that. We do get the patients, like I said, lumbar spine patients. We hook them up, and then we'll get them on the Bosu ball because they're sitting there moving and they're engaging, and they have to activate all these little intrinsic muscles in their spine. That's huge. Disc patients, spinal decompression is nice. It'll probably get you out of pain. But if you want to prevent it from coming back, a disc problem, you want to come see an ARPneuro clinic. You want to come see us because we do a lot of really cool things to make sure that we build up a muscle so that it supports your spine and so that disc doesn't get just beaten up with day-to-day life. So, boy, holy, we're at almost 27
Time
minutes again.
always
Here we are.
flies with you. I don't know what it is. I just actually looked at your clock and I'm like, wow, is it almost 30 minutes? I think I talked too much today.
No. If anything, I do. The thing is, this is so important. This is absolutely important for people to be aware of what ARP therapy is, because too many people have lost hope. They've had 1, 2, 3 surgeries, and they've gone to maybe a chiropractor, 2 chiropractors. They've gone to PT. They've had epidurals. I had a patient in today that has severe degeneration in the lumbar spine, and the doctor says, "Well, we ought to go and do some epidurals, and then we ought to do a cauterization of the nerve." And I was like, "I'm not against the epidurals." He asked me what my opinion is, and I said, "There's inflammation in there. I'm not against that. That'll calm it down." But to go in and do nerve ablation on your spinal nerves, going back to those joints, I said I'm totally against that for a number of reasons. First of all, you need those nerves so you know where your joint is. It's called proprioception. If you don't have those nerves firing, you don't know what's going on down there. More importantly, your brain doesn't know what's going on, and it will lower the threshold for pain. So I said, I wouldn't do it. The other thing, that those nerves regrow in 6 months anyway. And I've never seen one be ultra successful from a medical standpoint. That's the reason, if you're facing that, this is the tip tonight. If you know somebody, or if you are that somebody, and they're telling you you've got such severe degeneration, first of all, I would say, don't worry about the degeneration. It happens. Doesn't mean it's necessarily the pain producer. I would say you are not degenerated, you are deconditioned. And that's why ARP therapy works so well, because we can turn those muscles on. If you are facing nerve ablation, if that's something that they're recommending, I would say thank you very much. I would get up, walk out of the office. As soon as you shut the door to the office, sprint as fast as you can out of the building, get on Google the nearest ARP clinic, and go make an appointment. Or better yet, just take and come on up and see us.
I love that.
Shameless plug. Shameless plug. Yep. How does that happen? Happens every time about this
That's
time, doesn't it,
beautiful.
Jake?
I love it.
I should be embarrassed, but I'm not, because we got to get the word out there, right,
Absolutely.
Jake?
And I can vouch for your office. I've been there numerous times. I would even say, prior to you even getting the technology, you were kind of state of the art anyway. And you continue to stay ahead of the game, ahead of the course, and you stick with science. You know, you could probably be right, happy right where you're at. And instead, you continue to try to learn from other doctors. And that says a lot about your office. It says a lot about you. And I mean, you didn't ask me to fill you up here. It's just the facts of what your office is. And the fact that you went all the way to Chicago to watch Sam so you can better your craft at this technology, it just says, you're multi-dimensional in that office. And it's pretty amazing. I wish you were in Florida.
Well, I appreciate that. However, I still cannot snatch the pebble from my mentor, my master, my sensei's hand, Sam Battaglia.
He is the man when it
I am
comes
not
to
ready
that.
for that.
I don't know.
Oh,
I got to tell you, he is unbelievable with this technology. So if you're in Chicago,
I got my steps in, following from room to room, and I'm glad I stretched out, because I could almost pulled a hammy. Because, man, he's on the move. You walk in and he's on the move. So I got to give him a plug. If you're in the Bloomingdale area, the Chicago area, Dr. Sam Battaglia is the guy you got to go see.
Yeah, he is. I feel bad every time I send him a text, because I know every time he's with 3 or 4 patients all at the same time, and he works them all. So,
Well, and it's funny along the text lines is that I wondered why his texts are so short. I mean,
now you know.
oh, now I know he is not chatty with the text, but now I
He doesn't have
understand.
time. Yeah.
So exactly. Okay. Hey, this has been a great session of the Neuro Way to Practice podcast. Visit us on the website, tell others, and we'll see you in a future session. Take care.
See you later.